Hi, Dr. Lindsey and Wendy here. This is a video with an interview of an upper lid eyelid procedure that we did on a woman. How old is she, Wendy?
48.
So this lady works at the grocery store down the street. She's the manager, and we do a lot of our shopping there, and both for the house and for the office, right?
Yes. Mm-hmm.
And what you said she wanted to...
She knows, I think she's seen us one time together, and she asked what kind of doctor you were, and I said, a surgeon, plastic surgeon. So she always asks about, the about different things that she can do. And she mentioned that she was losing weight, and I said, you can always start with your eyelids. And she decided to come and do her upper eyelids.
Right. As far as the amount of improvement per dollar spent or ouch incurred, upper eyelids are the best value that you can do, because as we all get older, you sag from the top all the way to the bottom, and so your brow comes down a little bit, and a lot of people don't want to do a brow lift, it's just too invasive, but everybody gets a little extra skin on their upper eyelid, and there's usually a little fat in the upper eyelid that doesn't go away if you lose weight, or doesn't get more if you gain weight. And so when we do upper eyelids, and I've done about 7,200 of them so far, we take off a little skin, the scar will be in the eyelid crease and come out just a little bit, and we take out a little bit of fat, and it takes about, what, 20 minutes? Right? 20 minutes,
half an hour. Yeah.
Under local anesthesia. We rarely do these with any sedation. And you take a couple days without doing anything exertional, and the recovery time is very quick. So let's go through Tatiana's case, and then we have a little video interview with her. So here she is before, and you can see there's a lot of hooding on those upper eyelids. Hooding means extra skin and a little bit of extra fat, mainly towards the middle. And then here she is at day 8. Still a little bit of swelling. The stitches come out generally on day 2 and day 5. So the stitch has been out a couple days. Most people don't have much bruising. And so at day 8, there's really nothing left to do except let everything mature. And so we saw her back at 3 months. Here's before and here's at 3 months. And almost everybody says at 3 months, it's still, you could have taken a little bit more off. And the answer is maybe you can't. Maybe you could take a little bit more off, but there's often still a little bit of swelling. Because here's her picture at 9 months. And it's a world of difference, right?
It is. Yeah. I was looking in those.
Yeah, we rarely get to see that. We usually get to see people at 6 weeks or 3 months and then 5 or 6 years, when they show back up. But there's definite change from this 3 month to this 8.5 to 9 months out. And she looks completely unremarkable. Nobody stops and says, what did you do? You just look more rested. So watch this interview. Hey, Dr. Lindsey here. I'm here with Wendy, as usual, and Tatiana. It's okay to use your face and everything on my YouTube page, right?
Sure, yeah.
How old are you, ma'am?
51.
And when you came in last June, you were one of our first cases in the new office, and you had really heavy upper eyelids. And you're the manager of the Giants here, and I'm sure people are complaining all the time, and you're rubbing your eyes. And you look like this. You look tired, And so we did your upper eyelids under local anesthesia, and it took like 15 or 20 minutes. And you did fine. How much did the whole thing hurt? You can be honest.
Not much.
And then it kind of burns for about 2 hours after we do it.
Right.
And then there's no pain. And the problem is I got to convince you not to do anything for about 5 or 6 days, right?
Right.
So we took the stitches out. That picture is here. And then you came back at 3 months, and I rarely get to see people at 3 months and then at 9 months. And so at 3 months you look pretty good, but your eyelids are still heavy. Note that. And then here you are at 8 months, and if you look at the comparison between 3 and 8, 2 things. One is that the swelling is all resolved, and so you look better. And 2, you could argue, why not take a little bit more? Why did I take a little more skin off of one of those eyelids? And the answer is because we took so much off, you almost had trouble closing your eyes at first. And so perfection is the enemy of good. I probably explained that to you when you were here. Any comments that you would have for people?
Amazing. I mean, if anybody wants to do it, it's a life changing. I mean, you can tell in my face, I look completely different. So if anybody wants to do it, he's the right guy.
All right, well,
Yeah,
thank you so-
and yeah, people are always like scared, think that there's like
Right.
a lot of downtime.
I was
But I'm
afraid. I was afraid when I did. I say this is nothing.
Yeah.
Yeah, it's great.
All right, well, thank you so much for your business.
Thank
What do you want to add in, Wendy?
Well, she was coming, well, she came back because she was coming for the mini lift, and she's still losing some more weight, so she'll be ready probably in 3 to 4 months.
Yeah.
And she's really happy. The cashiers at the grocery store, they ask me and say, "What did you do to Tatiana?"
Yeah, yeah. Because it's not so obvious. It just looks like she had a vacation.
Yeah, she looks rested.
Yeah,
Yeah,
yeah.
yeah.
Anyhow, we do a lot of these upper eyelid procedures. They're quite safe, and they hurt very little. There's a little bit of burning for about 2 hours after we do it. And the results generally are, I won't say startling or striking, just refreshed appearing. So if we can help you, please give us a call. Thanks.